Thank you, Sydney. We are joined tonight by Dr. Ali Hassoun, an infectious disease expert at Huntsville Hospital, to discuss the search for a vaccine right now.
Thanks for joining us tonight again, Dr. Hassoun.
Thank you for having me.
Let's start here. A lot of people seem distrustful of a coronavirus vaccine. Nearly half of Americans say they won't get the vaccine if one even becomes available. Should everyone get it, and if so, why?
I think if we have safe and effective vaccine, I think everybody should get it to help get over this pandemic and get people back to their normal life as much as possible after the COVID pandemic ends. So the vaccine gonna be essential to cut down on the cases and reduce transmission. But on the other hand, I agree with the community and the people where we really need more information about these trials and about the studies and published in journals where everybody can have access to it and judge on it, in addition to the monitoring board that looking after all these vaccine trials. So I think it is important to do it, but we need to be also more and more transparent about all the information about these studies.
Dr. Harris told us that he thinks Moderna will be the first to develop a vaccine. We know that Johnson & Johnson recently paused its clinical trial. So in your opinion, which company will be the first to reach the finish line when it comes to a vaccine?
Yeah, you know, again, I think it's really difficult because these possible things that can come up where safety issues or concern about patient develop reaction is unpredictable. You hope at the moment between Pfizer, Moderna, AstraZeneca, and Johnson & Johnson, if they continue doing their trials with no issues of safety, we're going to hear about their data at the end of the year or early next year. So if 6 of them come together, that's the best thing because we can compare and look at what is the best, most effective treatment as a vaccine, but also what is the most safe and have no issues and problems. So it's really going to be difficult to tell which one because anything can happen in between now till a vaccine studies finish.
As we mentioned, Johnson & Johnson had to pause their clinical trial because one of the patients became sick. We know different medications can have, obviously, side effects. We should mention, though, we don't know if this patient who got sick was in the vaccine side of it or on the placebo side of it. The illness may have nothing at all to do with the vaccine. So, but let's assume that he is in the vaccine trial. How important is it if even one person has a negative reaction to a vaccine during the trial?
So then it's really going to depend on what kind of reaction. We know when we look at studies and research, we look at adverse event and serious adverse event, and on the top of that, if there is any death-related events. In each one of, there's a step in these. So if it's a minor reaction, that's not uncommon to happen. If it's a serious adverse event, depending on did it affect, for example, the central nervous system, the heart, other places, or other things related? Is it definitely related to the vaccine? So these are all important to know to decide, would I take it or would I not? How safe, but at the same time, how effective gonna be, and you weigh the benefits and risk between each of these. So there's a lot of information we're gonna need to get to decide, yes, even though there might be one patient, or let's say 1% side effect or adverse event, is that going to be okay in compared to its major benefit with reducing and clearing the pandemic? These are all important questions to answer, hopefully.
Dozens of states are seeing a spike in coronavirus cases right now, and health officials are warning that this could be the start of another wave of the virus. Here in North Alabama, there are nearly 150 coronavirus inpatients in the Huntsville Hospital System's facilities, rather. So, Dr. Hassoun, how concerning is this recent increase?
You know, I can tell you, and you've heard me before, this is not surprising, because we expected this gonna happen. It is concerning because it's slowly going up, and we really haven't seen yet the flu season. We haven't seen major change in temperature, because what we expect as the temperature get colder, people going to stay indoors more, so there's going to be more transmission. I think the explanation currently of why we're seeing increase, schools, all of it open, there is more exposures, sports ongoing, so there's a lot of events happening that's increasing this. And it is concerning, definitely.
Yeah. So the mask order still in effect, but Alabama's restrictions are loosening somewhat. Bars are staying open, serving alcohol later. These are some of the changes in your mind that are leading to this spike, you think?
I think so. And it's what is important. We want people to try to get back to normal as much as possible. But at the same time, we need to be aware that if there is increasing cases, we need to get back, reverse what we do, not completely, but partially, so we can control things. So we don't want a complete lockdown, but we want to do things on a stage basis. So if we have increasing cases, we close bars earlier, close restaurant earlier, make sure capacity get less, even virtual education go back. We need to think about it like that so we can manage our life and we can control the virus at the same time.
One of the nation's top health experts, Dr. Anthony Fauci, says relying on herd immunity is ridiculous. Explain once again, what is herd immunity and what are your thoughts on this?
So herd immunity is basically hoping people get exposed to infection, whether virus or bacteria, and it get to be widespread infection among population. And by that, because the body usually will develop some immune response, as you develop immune response, you're going to be able to control the viral transmission, because you, like the majority, will have some immunity against that infection. The problem with this concept is a lot, because you do not want to wait to have herd immunity, which usually means 60 to 70% of people will be immune. What that means, there's a widespread infection. This is a deadly virus. I cannot accept people have severe infection and people die from it waiting for that. That's a problem.
Dr. Hassoun is sticking around to discuss the pandemic's impact on the country and North Alabama.
Stay with us. You are watching Way 31 News at 6.
Coverage you can count on. You're watching Way 31 News at 6 with Dan Schaefer, Naja Sherman, Chief Meteorologist Kate McKenna, Sports with Lyndon Blake, and the Way 31 Storm Tracker Early Warning Radar Network.